Something that people are often diagnosed with or told they have is fibromyalgia. Fibromyalgia is very commonly an infection. And that's where Epstein Barr is common. That's where some of the other atypical infections like chlamydia pneumoniae and mycoplasma pneumoniae, some of these more or lesser known infections, but infections that can have a profound impact on a person's life. When somebody feels fatigued all the time and achy all the time and like their body's not functioning optimally, they'll often go and obviously get worked up and been given a diagnosis of fibromyalgia. What's important is that fibromyalgia is a real thing, but it's a collection of symptoms. It's a syndrome. And in medicine, a syndrome is exactly that, collection of symptoms. It's not a diagnosis, which means there is a known cause, and then there's a known specific treatment. And so understanding the differentiation between syndrome and disease is very important. Fibromyalgia has been categorized sometimes as an autoimmune condition as well. I think at the end of the day, it's important with each person who's been given this diagnosis to really drill down into what symptoms they have, when they're worse, when they're better, what are some of the other factors that are happening at the same time, what happened at the onset of the symptoms, because typically there was an inciting factor. When you start questioning, about history, it's a never better since kind of scenario. Well, what was that? Often that informs the cause, or at least something that's significantly contributing to the disease. And so again, with Epstein Barr, with chlamydia pneumoniae, with mycoplasma, if the never better since factor was mono, Epstein Barr is a high likelihood. If the never better since situation is a pneumonia or a chest infection, then we start looking down the other pathways. And if it seemed like it was a broad general, whether it be a trauma or whether it be some other physical stressor or emotional stressor, well, then we just start digging down and doing some testing and doing trials of treatment.